This will be another design in a patient who has a class 1, modification 1, that needs a partial denture. Now in this case we can see that we've got very few abutment teeth. We've got distal saddles, which are always a challenge because of the difference in replacement of the soft tissue and the tooth. And we've got so few abutment teeth. So if I have to construct a metal partial denture, in this patient I will always be using a lingual plate, because the lingual plate will also provide horizontal stability as well as indirect retention. And because I've got long saddles, I have to replace quite a few teeth. I would expect that my abutment teeth may be subjected to more rotational forces because of the difference in the displacement. This is a class 1, modification 1 metal partial denture. I've indicated that I will replace posterior teeth as well as the missing anterior teeth. My guide planes will always be in contact with the teeth. The next step is then to provide support. Support is always provided on the abutment surfaces of the teeth. On the canine, because I'm going to use a plate, I'm going to use mid-cingulum rest. And my third rest, I will use the 3-3. As in upper lateral incisors, lower incisors are not the most ideal abutment teeth to provide support. The next step is to provide retention. And here I'm going to use a stainless steel clasp that is soldered onto my framework, engaging mesiobuccal undercut. And as always, I'll have to provide reciprocation. I'm going to use another C-clasp on my canine because I need 2 rest. And again, reciprocation. So that I make sure that I have a clasp and I have provided reciprocation. I'll then have to connect the separate components, and here I'm using a lingual plate, so it will be covering all the teeth. I'm connecting my separate components. I'm indicating my retention holes. I've indicated that it must be a soldered C-clasp. I've got my 1, 2, 3 rests. I've got my 1, 2 clasp, because it's C-clasp that's soldered on. I cannot use a circumferential clasp. And here, because it's stainless steel, I can use a 0.25 undercut and indicate to the technician that he or she should be soldering on a 0.9 diameter wire. So this patient will have a metal partial denture, that's a lingual plate, and the reason for that is that I have very few abutment teeth, long saddles, many teeth to replace. I'm using the plate to provide horizontal stability as well as indirect retention. So I'm covering all my teeth, and we expect this denture, the prognosis of this denture, to be slightly less because of the sizes of the saddle and the few abutment teeth. If an acrylic partial denture was indicated, we'll also be using covering all the teeth, having my 1, 2, 3 rests, my 2 clasps that's added or mechanically joined to my acrylic. And you can see that in practice, acrylic partial denture, the prognosis or the success of an acrylic partial denture in a class 1, where I have long saddles, so my occlusal length, my occlusal plane has to be quite long, depending on the opposing arch. Few abutment teeth, that's providing resistance to the horizontal movement. So the acrylic partial denture, the prognosis is usually not as good as for a metal partial denture. So the fewer teeth I have, the more I have to replace, the slightly less or the success of this denture will be. I'm going to